My name is Abby Drucker. I am a gynecologist. I practice in Spencer and at Lakes Regional Healthcare. I'm originally from Omaha, Nebraska, and that's where I grew up and I did my medical training, a combination between University of Nebraska and then residency at Creighton University down in Omaha. After I was done with residency, I went to do a pelvic surgery fellowship in the suburbs of Chicago, and then we moved to Spencer about 6 years ago. I'm married. I have 2 little kids, a 3rd grader and a 3-year-old at this point, so we're pretty busy. I think like so many people, I went into medicine because I wanted to help people and I liked science. I think as I've grown in my career, I've stayed in medicine because it's a career that's always evolving and so many things change in terms of surgical care, medical care, things that are available to people. So from a science standpoint, it's something that really keeps you thinking and keeps you on your toes. But I also like that you can merge both science and critical thinking as well as relationships and care for people. I went into gynecology because I really like women's health care. I like the combination of building relationships with patients. I like the preventative care that you can provide. I like to take care of people when they're sick and help them. And I really like the surgical aspect of it too. So it's a nice merge of a lot of the aspects in medicine that I enjoy. I really enjoy practicing at Lakes Regional Healthcare because it's a small hospital, but it has big kind of bones behind it. It's a place that does have a lot of really current and good technology available to us. You know, you can get the same surgical care and surgical technology in a small town as you would in a bigger city. But being able to practice in a smaller town, in a smaller hospital, really lets the physicians, the nurse practitioners, the nursing staff, everyone in the hospital know our patients, take good, I think, better care of our patients. I think the administration is really helpful at allowing us to bring new programs and find new avenues to better serve our community. No question is dumb. I think so often we are, especially in women's healthcare, sometimes these are sensitive subjects. There may be subjects that we're embarrassed about or that we don't want to talk about. And so I really want my visits with patients to be a trust-based relationship in a safe area so that they can bring up things that are really concerning to them. So I think that a good kind of rule of thumb that I always try to, or a good piece of advice that I try to pass on to my patients, is that there's no dumb question, you know, there's no stupid question. If you have something that's concerning to you, you don't lose any time by just coming in and talking about it. You can be a really good doctor and you can be a really smart doctor, but unless you have the relationship and the trust of the patient and her family, it's hard to kind of build those bridges and make a difference in whatever preventative health care or whatever problem health care someone is seeking. And so I really try to form that relationship with patients so that I know where they're coming from, they know where I'm coming from, and I think that helps to build a better coalition to take care of communities. We do work long hours and it's stressful work, absolutely, but when I'm able to see a patient back that had been struggling with a problem for so long and then she was able to have surgery and we're able to really help her make a difference in her daily life, how she goes to work, how she takes care of her kids. When you really see how on the backside that has positively affected a woman's ability to live the life that she wants to live, that's really rewarding. I have 2 little kids, and so nowadays my free time is kind of between the hours of when I put them to bed and when I fall asleep, and so some nights that's probably about 45 minutes. We really spend a lot of time outside. We're a big soccer family. We enjoy going on bike rides. We started a nice little vegetable garden in the backyard, so really get a lot out of spending quality time together, watching our kids change and watching as they grow. You know, I grew up in Omaha, and so when I was a kid for a couple summers, we did have the connection up in Okoboji to come up and spend summers at my grandma's cabin. And then, you know, it's kind of been lost to me until we moved here as adults. And it's such an amazing place to me to have such a community that really draws generations of families back together year after year after year. And so it's really impressive to me the amount of community spirit, the amount of community pride that the Lakes region has, and I'm just happy to be part of that.